When I see patients for the first time, they're often very overwhelmed. They don't feel well, they're not motivated, they feel like their health goals are kind of insurmountable.
In the U.S., the average age of menopause is now 52. Now, the range of time that can take to occur is anywhere between age 45 through age 59. So that's a huge span of time in which women can start to feel terrible, end up going into menopause, and then really be miserable.
A lot of people wonder if something is wrong with them and their hormones or if this is just normal. Menopause and what I call menopause are normal signs of aging. The ovaries and the testes decide to take a back seat and stop working like they did in your 20s. The benefit of pellet therapy is you don't really have to live with it, and we can safely reverse that so you can feel your best.
So a lot of people are like, pellets, wow, I just heard about pellets. What about these things, these new things? Well, they're not new. Pellets have been done in the United States since 1939 with better living through chemistry. So in the 50s, you could take a pill, you could get a shot. Dr. Tutera, gosh, probably 25, 30 years ago, learned about pellets from a Canadian physician who was doing them that wanted Dr. Tutera to start taking care of some of his patients. Back then, it was more a couple sizes fit all. Dr. Tutera really got into it, looked at the science. How do we best treat these women? How do we do the labs? How do we figure out what's best for the individual? That's the real key to SottoPelle therapy. Dr. Tutera made these determinations. In some ways, when I finally learned that, my light bulb went on and I just went, wow.
Helping people with their hormones is so rewarding. I absolutely love to hear the stories of patients where they feel like we've saved their marriage, things were not good, and it was a result of lack of hormones. They're handling their stress better at work, they love what they do, they're kind of finding their joy in life again.
Physicians come in who really are hungry for knowledge and really want their patients' health to be optimized. We deal with men, women, transgender patients, women who are premenopausal, women who are postpartum with depression, Parkinson's patients. Their motor skills are helped tremendously with testosterone. All sorts of individuals that can be benefited by hormones.
This really allows them the motivation, the stamina, the willingness to start making more small goals. Oftentimes, once they're feeling well, we start with movement, we start with diet, and we make little changes that feel like nothing now that they're optimized and feeling better.
We have a lot of previous Hall of Fame football players who've had traumatic brain injury who are coming in who are getting pellets. And some of these guys have been near suicidal, some of them almost unable to function mentally, who are now living really amazing, healthy lives. This sort of thing is the type of changes that can be affected by a physician coming in and learning to do what we do.
So hormone therapy via pellets is really easy. The insertion process takes about 5 minutes. You're numb, there's no pain. The incision that we make is so small we don't even use a stitch. The pellet that we insert is very small. The biggest pellet we have is about the size of a grain of rice. We put a little tape on it and close it up. There are a couple common side effects associated with hormone therapy. Generally speaking, for women, men tend not to experience as many. For women, the first thing they may experience is a little bit of breast tenderness, similar to that before a menstrual cycle, and this is safe, it's not dangerous, it's just a little bit of a flux of estrogen. The second one they experience, I joke with my patients, it's usually hairy and horny. Horny is a great thing, hairy is not. And the hairy they experience is the occasional stray chin whisker. And a lot of my patients return to me with that little whisker and they say it's worth it, they feel good, we'll manage it. The biggest fear women have about hormone therapy is cancer. A lot of this is misinformation that's been restudied and reevaluated. The biggest thing women should know is that estrogen therapy does not cause breast cancer. What it can actually do is potentiate cancer that's already there. It can make it grow faster. The important thing is that your hormone specialist is checking to make sure your mammograms are normal and everything's healthy before we even start therapy. If everything's normal and healthy, you have no reason to feel that your estrogen will cause that cancer. If that were the case, every young woman in their 20s would have breast cancer.
So more and more physicians are having their light bulb going on. They're seeing patients who are getting results, or they're reading about them and they're saying, gosh, I want to do this.
Most doctors dabble in hormones and they've been taught in their teachings, but it really requires extra training, extra focus, and a fine-tuned eye for hormones.
So why would a physician want to transition his practice into doing part of this or even all of this? Well, some of it is because you're just not seeing results with your patients. You know there's got to be more out there. You've probably had a few patients that have done pellets and are giving you rave reviews, and now you really want to see what it's all about. So you should really look at this for the benefit of your patients. Now, that also benefits you.
I'm really proud to be a SottoPelle doctor. It was a goal of mine before I even became a hormone doctor. SottoPelle is the leader in hormone therapy, and I really feel as though the doctors here know what they're doing, they have the experience, so we really do specialize in this.
The good news is it's a cash business. So you're not waiting 3, 5, 6 or more months to get a reduced payment. So those patients are paying you by the time they leave your office. It's cash on the barrelhead, and you're not going to be dealing with those sorts of cash flow problems that you probably have to deal with right now. A lot of patients only will do things if it's covered by insurance, but if they find out that it really benefits them as much as it does, they're happy to come up with the funds to cover that. When you come to us, you get as personalized training as we can do it. A lot of it is being done on the internet nowadays, but you can still have consultations directly with myself or a few other providers here who are seeing patients day in, day out. And we're going to support you in what you do, and we're constantly changing things, and I'm proud to carry on his legacy and continuing to help humankind, men and women, to live their best into the next century.